cost much. Whether you know a lot about teeth or you just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in the dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask more questions during the live show. Before we start, let me tell you a little bit more about Dr. V. He's not just a regular dentist, he's a periodontist, which means he's an expert at certain types of dental care. He works at ToothHQ Dental Specialists in the Dallas Fort Worth area in Texas. And guess what? He has a book coming out next year. So if you want to know more about Dr. V, just check him out at our website at www.mytoothhq.com. So let's get comfortable, relaxed, and ready to learn lots of cool stuff about taking care of your teeth. Let's begin our dental live show. Welcome, everyone. And now let's welcome Dr. V and start our show.
Man, that's an awesome introduction. I almost thought like your teeth are going to all fall out with all the smile that you have, man. So let's keep smiling, right? Thank you, everyone. I'm Kumar, Dr. Kumar Vadivel, but you can call me Dr. V, like Fatima said. I'm very excited to be here with you all today again. Let me tell you a little bit about myself. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that support your teeth. I'm also skilled in dental implants and oral surgery. I'm part of the American Academy of Periodontology and the American Board of Periodontology, which is a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialist, and we have 4 offices in the Dallas Fort Worth area, as many of you guys may already know. We are all about making sure that your teeth and gums are healthy and strong. Now, I'm here for you. I would love to hear any questions you might have about your teeth and gums, and you can ask questions live right now or even send them in for our next show. Your questions really help us make these shows really helpful for everybody. Guess what? We have viewers all around the world. And one more thing, if you like what you are learning here, please let us know. We need some pat on the back, right? So your feedback is super important to us, and don't forget to subscribe to our live channel so you won't miss out on our latest updates and helpful tips for your oral health. I'm looking forward to a great show and talking with you all and answering more questions. And let's make our smiles the best they can be, right? Let's do it. Don't let your teeth fall out,
Okay.
okay? Then I don't want to be fixing your teeth while the
Okay.
show is going on.
All right. All right. So, Dr. V, I have a question. It says, I have a grade 1 periodontal disease. Which type of floss is better for my condition? String floss, floss picks, or water flossers?
Well, so you guys heard the question, and irrespective, this person is actually saying they have type 1 periodontal disease. What that means is, there are different levels of periodontal disease or gum disease. We got type 1, type 2, or just in simple terms, mild, moderate, and advanced, right? Or mild, moderate, severe. Irrespective whether you have periodontal disease or not, it doesn't really matter even when you have healthy teeth. And you really need to be using one of these tools here that the viewer mentioned here, which are the floss picks, or the water flosses. In my opinion, the string floss is a lot better because actually, if imagine this is the tooth, right? Then what you're doing is you're actually putting the floss around, and then you're going around to almost take the plaque away. And I actually have a YouTube video you could actually go and see after you brush your teeth and after you floss them, how much of plaque sometimes you may still have left out. You think that you got them out. So, in my opinion, the string floss is a lot better, and we are always big believers, and we want to give you something that you really are going to continue to use, right? Are the floss picks better than nothing? Absolutely yes. Or the water floss is better than nothing? Absolutely yes. So the best ones are the string floss. The next is the floss pick, and the next one, in my opinion, is the water flosser. Just do it, just like we say, right?
Yeah,
Go
just
Nike,
do it. Go
right?
Nike.
Yeah, there we go, right? Yeah.
All right. So our next question is they said, "Hey Dr. V, are x-rays necessary during every checkup for preventative care?"
So, absolutely, the x rays are essential. You know what we do, right? During the
Yes.
checkups, right? So, not just the periodontal disease, but also we check for cavities. So, depending on how often you're going for cleanings, most patients we recommend that they come back when they have healthy gums and healthy teeth. They come back every 6 months for their routine cleanings to the dentist. And when patients have gum disease, we recommend they always come back
Every 3 months.
every 3 months. Fantastic, right? So they come back every 3 months. So when they come back every 3 months, depending on the level of care they need, if they have dental implants, we check the dental implants with X-rays, and if they come back every year, we check for cavities. We check for cavities with the X-ray. So speaking of the X-rays, you are going to get the X-rays done either every 6 months or every year you go to the dentist, or at least like a minimum of 1 year, unless they really think that uh, it is required sooner than the year. But you are going to get, for the most part, you are going to get them once a year.
Okay. All right. Our next question is, I was under the impression that gum disease only affects the gum around the affected tooth. Is that correct?
um, it's possibly a myth, right?
Yes,
Where do you see
possibly.
gum disease?
In the x-ray, well, it's on the gums,
On the
really.
gums everywhere
Yeah,
for the most part,
for the
right?
most part,
Yeah,
yeah.
for the most part. So the gum disease, as we normally say, it's a gum disease. It's like, I always tell my patient, gum disease is like, it's a bacterial disease. It's almost like termite. And imagine when your house is infested with termite, right? And it is not going to be just the one spot. It is going to be all around the house or all around the affected area. So either you have gum disease all around one side, we call it as a quadrant, or you may have affected gum disease, like maybe severe on one side of the mouth, and maybe it's not as severe. But pretty much the gum disease is going to be all around your mouth because it is a bacterial disease. Depending on the type of damage, like you may have more severe gum disease in one part of the mouth as opposed to the other side. uh, to answer your question, it is not just around one tooth. It's mostly the entire mouth, and you may have the severity of the gum disease maybe more on one side than the other side. And also, you mentioned just the tooth, but people have a tendency to think, well, I'm going to get implants and I'm not going to worry about like having to come back to the dentist or having to brush or floss my teeth or the implants particularly. Gum disease, for the best thing it can be, right? Like it is made of metal, the dental implants, and you don't get cavities on the dental implant, but you are going to get the gum disease. So we always tell a patient, so you always have to come back and get your dental implant checked to make sure that they don't have gum disease around them. Yeah.
Yep. Good answer. Good answer. All right. The fourth question is, does ToothHQ Carrollton office offer any discounts for procedures that are not covered by insurance?
Absolutely, we do. So, as many of our viewers may already know, if you guys are in the Dallas-Fort Worth area, come see us. And we are one of the few specialist offices. We do not charge for the consultations and the CAT scans that you guys get, right? And make sure that you heard me on the live show here, and we'll make sure to honor that. So you get a free consultation and the free CAT scan. And guess what? After you guys come in, depending on the level of treatment that you're going to need, either we offer cash discounts or credit card discount, or either one of those. And if you're not able to pay for those treatment, we even offer a lot of payment plans. So come see us at ToothHQ, either in our Carrollton location or in any of the other 3 locations we have in the Dallas-Fort Worth Metroplex, and then we can definitely help you.
Yes.
Awesome.
All right. Next question is, since I'm allergic to titanium, is it still possible for me to get dental implants?
Absolutely. Anybody is a candidate for dental implants. And although the titanium allergy is kind of very, very rare, and I've been practicing for the last about 3 decades, um, and I have not seen a true titanium allergy. And although patients tend to think that sometimes the implants kind of fail, they tend to think that they have allergic to they have allergy to titanium. So that's not the true reason why the implants fail. Implants fail for a variety of reasons, just like we may have talked about earlier. They get gum disease around them because patients don't maintain them, they fail, right? So to answer your question on what are the alternatives to titanium implants, and we have zirconium ram, as we call them zirconium implants. So they are mere ceramic or white implant that you can see, and these are tooth colored or ceramic colored, or they are made of they're made of zirconium. So if you have a true allergy to titanium, um, come see us at Tooth HQ. We can definitely help you, or talk to your dentist about whether zirconium implants are an alternative for you.
Yes. Okay. Why do my teeth have white stains after professional teeth whitening?
So, great question. So, what they are referring to, what the caller is referring to, is you go to the dentist and your goal is to whiten your teeth, right? When you come out of the dentist, you want the teeth to be white. And when you come out with the teeth being white, now you're going to start to see some spots on the teeth are going to be even whiter than the your white teeth. So the reason it happens is because whenever you are going to get your whitening done at the dental office, some areas of the teeth, they may either we call them calcification on the teeth, right? Your teeth are made of calcium deposits, or your teeth have calcium the teeth have the calcium mineral on them. So some of the areas on the teeth may get dried out, or some of the teeth may lose some mineral more than the other parts of the tooth. So those are going to appear white as you come out of the dentist. The good news is you probably did not see the white areas before you got the whitening treatment done. So now what's going to happen is, over a period of time, when those areas are going to get hydrated, or when they are going to get wet over a period of time, it may not happen just like that. It may take like a couple of weeks, or maybe even few weeks. So they're all going to kind of even out. So those are the white areas that you see as you come out of the whitening procedure from any dental office.
That's some good information. All right. The next person said, I've watched your video on inflamed wisdom teeth. I have the same issue with my lower jaw wisdom tooth. What is the best option for treatment?
So what do we do? What do we do when patients come with the wisdom teeth in our office? What did we do this afternoon?
We take them out.
Right? Yeah, we take them out. We take
All four out.
all 4 out, right? Yeah. So a true story. This happened. So this came in this afternoon. She had inflammation just on the one spot that she could feel, but I could see the inflammation on the bottom right side, and I could possibly foresee that happening on the 2 top wisdom teeth. So what did we do today?
You took
We
them
gave her
out.
sedation,
IV sedation.
right?
Yep.
And
We numbed her up really good. And
and
we took the tooth out.
all
All four.
all 4 of them. How long did it take?
Dr. V, you're really fast. So I think he was done in like 10 minutes tops.
All 4, right?
Yeah, the patient even said, is the setup longer than the procedure? I said, Dr. V is really fast. You won't even know. And when you left out the room, she was like, that was fast. I feel like he just got in here. I said, yeah, he's really, really fast.
Awesome,
So
awesome,
yeah.
very good, very good. Yeah. So to answer your question, so you will see the inflammation on one tooth. Yes, that tooth definitely needs to come out, and you may not feel the inflammation on some of the other sides. And then we still recommend an one and done, right? So you want to be put to sleep and get it done and over with. Um, and there are some alternative to, like, you can, just take the gum around the tooth and you can try and keep the area clean. Guess what? You don't want to end up leaving that inflammation. And we always say prevention is better than cure, right? Sometimes you may not know you're going to leave that inflammation. You're going to end up actually damaging the tooth next door because you're going to have the cavity spread to the tooth next door. So when you have inflammation, don't even think about it. Just get it out and be done. That's what I would recommend.
Yep. Get it out. All right. So the next question is, what are the differences between a tooth infection and gum disease?
Um, they're all kind of caused by bacteria, tooth infection or gum infection, right? So sometimes it could be a bad thing or a good thing, right? Gum disease, we call it as like it's kind of a slow poison that totally destroys or kills your teeth. Sometimes we see patients here, they are kind of in the end stage of the gum disease. The teeth, either some of the teeth they already fell out on their own, or they are ready to fall out. They are so wiggly, you can actually, we tell them, hey, put a floss and then you pull them out, right? Like, that's how badly it could get. um, so either way, it is a tooth infection or gum infection. They're all kind of bacterial disease, and uh, they are all going to cause damage to the tooth, and they all are going to spread to the gum and the bone surrounding the teeth. They're all going to cause pain, discomfort, and swelling, and the key is, this is what most patients forget, or sometimes they may not have a good understanding, or the gum infection. It is not just going to stop in your mouth. So we always say that anytime you have infection in your mouth, it's just going to get right into your carotid, goes into your heart. From there, it's going to go to your kidneys and lungs and pancreas and all the way to the brain. So infection is an infection, tooth infection or gum infection, it doesn't matter. So it is going to cause the same damage, and it is the same. You have to take it the same serious way that you have to take it, either it is teeth or the gums.
Okay. All right. This one says, hello, doctor. I'm an avid watcher of your dental chat program. As a beginner dentist, I have a question for you. What is the step-by-step treatment plan for grade 2 furcation involvement in periodontics?
So, um, thank you for being an avid watcher and being a dentist, and it is our honor, and being a dentist, and you still watch our show, and thank you very much. So what the caller is referring to is, or the dentist is referring to, is anytime you have a back molar. So these are kind of the back molars, and you guys can may see. So particularly the the bottom ones, you can tend to see what he is referring to is the furcation involvement. What the furcation involvement is, the bottom teeth have two roots, the front and the back, and then in between you're going to get some bone loss, and that's what he's calling it as a furcation. And matter of fact, things happen in our office, and we had a referral from a dental office today. The dentist was referring to is the bifurcation, and the patient kept saying, oh, I have bone loss in the bifurcation, I have bone loss in the bifurcation. And because the dentist has tried to explain to the patient they have a bone loss and the bifurcation to better explain to the patient, that's what the patient was referring to. So what we recommended in our office is we do laser treatment in our office. So we wanted to control the gum disease, to prevent any kind of further bone loss. We do laser treatment, multiple kind of lasers that we use to control the gum disease, and also sometimes we do, because of the bone loss the patient is experiencing, we open up the gum tissue, we add some bone to regenerate the bone. So there are multiple treatments that are available for what we call it as a furcation involvement or a bifurcation, either on the bottom molars or on the top molars. So we either treat them with a laser, different type of lasers that we have available, or we call it as a gum surgery or a flap surgery. We open it up, clean everything out, and add some bone, and also kind of what we call it as a reconstructive or a regenerative materials that we add to reconstruct the bone and the gums and then the root surface of the tooth.
Okay. We have some live questions, so I'm
Oh,
going to
good.
ask some live questions. All right.
Okay.
So the first live question we have says, I'm Connor, 47 years old. I recently underwent a session of laser gum therapy for my gum disease. After the treatment, I started noticing large boils on my cheeks, which are very painful when eating. I want to know if it is normal to experience these boils and ulcers on the cheeks.
It is not uncommon for not just the laser treatment. It is not uncommon after any type of dental treatment to have some kind of an ulcer, some kind of ulcers in the mouth. These are called like aphthous ulcers, and it is not uncommon. What happens is anytime you go through any kind of a dental treatment, so your body or your particularly your mouth undergoes a lot of stress, and then now it changes your immune system, and now you're going to throw out these ulcers in either the cheek or anywhere inside the mouth. People sometimes experience all the way into the back of the throat also, or on the around the gums, and or on the roof of the mouth, or mostly it happens on what we call it as a mobile mucosa, the teeth or the cheek or the throat or the palatal area, where the tissue is kind of moving. That's where you're going to see those ulcers, and we call them as aphthous ulcers. So it's not uncommon at all. So whatever you're experiencing, it's not uncommon. Most of the time it is going to go away on its own. You don't need any kind of a treatment. But if you are really concerned about it, then you can talk to the dentist, and then they can give you some kind of an ointment, just to kind of soothe in the area. That's pretty much it. But even if you don't do any treatment, it is going to completely go away and absolutely not a problem.
All right.
Okay.
All right. How much does an arch of all four dental implants cost?
So what this color is referring to is an all on four, meaning we say that all on four or all on X dental implants. So those dental implants are like this right here. So they are referring to like a complete set of fixed teeth, so they don't ever come out. So when you have a problem with your teeth, either you can get some dentures like this, they come out, which we do not absolutely recommend at all, or you can at least at the minimal, we want you to get what we call it as a snap. So you just snap the teeth, and so that way the denture is not the denture is it is going to be completely insecure if you don't have any implants, as opposed to at least when you have a minimal of two implants, 2 to 4 implants, and you can get a snap on. But what this person is referring to is an all on four or an all on X, which is a fixed teeth. These range anywhere between about 25 to $30,000. So depending on the where which part of the country that you're going to live in, at the minimal, it is going to be about $20,000 and up, as opposed to the removables. They can be a little bit cheaper, as opposed to the dentures with no implants are going to be a lot cheaper, although we do not recommend that. So to answer your question, the all on four implants or all on X implants, what we refer to as a fixed teeth implants, fixed the teeth, fixed teeth on the implant, they start anywhere from $20,000 and up. And talk to your dentist, and they should be able to help you.
Okay. Hey, Doc, can you suggest a few quick DIY fixes for yellow teeth?
Man, it's a long, long question, long answer for your short questions, I should say. Well, DIY fixes, right? First thing is, of course, a lot of people have the myth thinking that they have a large calcium deposits or tartar on their teeth and then they want to fix it. There is absolutely no fix to that. You need to have dental treatment done. As opposed to, if you think that you have healthy teeth and they are not calcium deposits or tartar deposits on your teeth, and you have healthy gums, they are not bleeding or anything, you can try some baking soda, you can try some hydrogen peroxide, and you can try some over the counter teeth whitening strips, or people sometimes they even go to Amazon to buy some lights, the UV lights that you can pass on. You can apply some gel and you can pass on some UV lights. And then a lot of times, it could be just a habit breaking, right? Like people have a tendency to drink coffee or tea or even the soda all the time. They think that it doesn't cause any damage. Unfortunately, coffee stains your teeth, tea stains your teeth, and the soda stains your teeth also. And one of the things that we so avoid those, right? And then one of the other ways to avoid the stains is or the yellow teeth is to eat some crunchy foods like a fibery foods. For example, eating crunchy vegetables or eating apples and bite on some celery. These are all kind of because they rub on your teeth when you bite them, then they kind of take the stain away. So try them out and you'll be happy.
That's some good information.
Awesome, awesome.
Does ToothHQ offer free dental care for seniors?
Uh, we really wish like we want to be able to offer free dental care to within the power we can, right? So we do offer free uh, consultation and free CAT scan. Unfortunately, at this time, we do not offer free dental care, although we do know of some facilities after the seniors come in here and we find out they need some dental care and they don't have the money to get the dental care they need. We find the right place for them. Okay.
All right, it's time for another live question. I
Ooh.
like the live questions.
All right.
All right, so my 6-year-old daughter has a wide space between her front two teeth with tissue present between them. One dentist recommended performing a frenectomy immediately, while another advised waiting until she's about 8 to 10 years old, saying it would be more effective then. I'm really confused and would appreciate your guidance.
So what we are referring to is an extra gum tissue, what we call it as a frenum. So a when you have a, I'm actually going to pull up a picture that may be easier for you to see here. I'm going to call it as a frenectomy, and let's see what it comes up with. This is something that we show our patients all the time. Um, so the frenectomy is when you have, I don't want to gross you guys out, so I'm looking for a better pictures, an easier picture. There we go. Bingo, right here. So this is what we refer it as a frenum, and this is after frenectomy. So you guys can see the muscle here, see the attachment that I'm referring to, and this is after. So my recommendation is the sooner you do it, the better it is. Or, in other words, and I can tell you, by waiting, you're not going to achieve anything better. Although, what the dentist may be referring to is you may have to have the frenectomy done again after the braces treatment. Um, so in my opinion, get them done now, and we do them on patients as young as maybe about 8 or 10 years old. Here we do the frenectomy. Although a lot of times, and when we see the patients being referred for frenectomy or during the braces treatment, and then guess what? A handful of patients, and I always have this conversation. The frenectomy was not done early enough either pre-braces or during the braces, so we see them after the fact, after they're adults, or they're kind of teenagers and they're go ready to go to they're after either teenage year, they're ready to go to college. Now when we see them to have the wisdom teeth removal, about 20% of the patient that we see, they still need the frenectomy. So you've seen that done multiple times,
Yeah,
right?
yeah.
So the frenectomy, we do it as part of the wisdom teeth procedure. So to going back to your question, just do it. Don't wait, and I don't think it is going to change anything.
Okay. Now we have some rapid fire questions, okay? But Dr. V, you only can answer them in 1 to 2 sentences, okay?
Okay, man, I'm
So,
gonna try.
so 1 to
Don't put
two.
me on a spot.
All right, this
Are
is
you are
this is
you
an easy one though.
are you telling me that I keep talking?
No, wait, you can't. Only 1 or 2 sentences,
Okay, man,
okay?
I'll
But
try.
this is an easy one. This one is easy. Do mouthwashes treat gum problems?
Yes, they do to an extent.
Okay.
That means after you get your deep cleaning and after you get your treatment done, then they do to an extent. But
Okay.
don't forget the brushing and flossing, though.
Okay.
Okay,
All
all right,
right.
okay.
All right. All right. So then we'll go back to some other questions. All right.
Yeah. So
All
we
right.
got
So remember, 1 to 2 sentences. All right. I often skip brushing my teeth at night. Could you suggest an easy alternative for maintaining my oral hygiene?
um, put your timer on or the alarm on,
Yeah.
right? Okay. So well, unfortunately, there is no alternative to brushing your teeth at night. We always recommend brushing twice a day. So if you can't brush it at nighttime, just find a way to do it twice a day.
Good. Good. See,
Yeah.
you're answering them real good.
All right, man. I'll try. Keep trying.
Okay. All right. How can I improve the strength of my enamel?
Multiple things that you can do. Limit your sugar intake and food intake. Do at nighttime. Better oral hygiene. Chew gums on a very regular basis. Consider fluoride treatment at the dental office. Use the right toothpaste, and then and if you have any type of dry mouth or anything, treat the dry mouth. Multiple things you can do.
Good, good. All right. I have Medicaid insurance. How often does my plan cover routine checkups and cleanings?
So, depending on the type of Medicare coverage that you need, there is a lot of time that we see patients, they have supplemental coverage that has the PPO or like whatever coverage that you're going to need, right? So, most of the time that we see, they are going to cover cleanings twice a year at the minimal, and the x-rays at least once a year.
Okay. All right. I am quite curious to know which toothpaste do dentists use. That's a good question.
Man, I don't want to get into trouble by saying a brand name, right? I'm just kidding, right? So anything, any fluoride toothpaste is what I recommend. You can walk into any store, even a generic toothpaste, should work, or the store brand should work. Colgate, Crest, or baking soda, not baking soda, that doesn't have the fluoride in it, but any fluoride toothpaste, should work, and then you should be good.
All right. Okay. Back
We're
to
going
our
back to our regular
yes,
questions
back to
now.
our regular questions.
Okay.
So this one says, I use charcoal toothpaste and recently read in a medical journal that activated charcoal might be car-
Carcinogenic.
carcinogenic.
Yeah.
Is there any truth to this claim?
So, what this person is asking is the charcoal, meaning like the black charcoal powder, right? Whether it is carcinogenic. What that means is carcinogenic means it is cancer causing. So, what they're asking is, using a charcoal toothpaste can cause cancer. So, there is absolutely no truth to that. Charcoal toothpaste has nothing to do with cancer, and although it may cause other damages because charcoal is it's an active abrasive. So when you have the some of the toothpaste, they have a little bit of a charcoal as an ingredient, but when you use a lot of charcoal, it can absolutely abrade your teeth, meaning like it can erode your teeth. And there are some, there are some studies that we have found the charcoal, depending on the type of the charcoal toothpaste, they have some contaminants that some studies have reported. Although most of the time, if it is an FDA approved toothpaste, and you may not see those contaminants in those toothpaste. But the one disadvantage too is we always recommend fluoride treatment to prevent cavities, and the charcoal toothpaste does not have fluoride in them. So if you're really concerned about the benefits that charcoal is going to give you, my recommendation is use a fluoride toothpaste in the morning, and fluoride the charcoal at night, or vice versa, charcoal in the morning and fluoride at night. So that's what my recommendation would be.
Yeah, because I use the charcoal too.
You do.
Yeah.
All
So
right.
I'm going to switch it up.
Okay.
All right. I have crooked teeth that were corrected, and now I'm worried my 4-year-old son might also develop crooked teeth. How can I prevent this?
All right. Like mom, like Sam,
Yeah.
right? Okay. All right, man. Okay. All right. So, you're absolutely correct, right? So when you have crooked teeth and you're always thinking that is my your 4-year old son going to get it, right? So whenever we do braces treatment, there are multiple phases to the treatment that you're going to get. We call it as a preventive orthodontics, meaning you can actually get braces to prevent any type of what we call it as a crooked teeth or malocclusion, we call it. And then we call it interceptive orthodontics, meaning you can get them early enough to prevent any type of malocclusion or the crooked teeth. So if your son is a 4-year-old son, and particularly if he has any type of habit, such as what we call it as a thumb sucking habit, or the tongue thrusting. Sometimes kids have a tendency to thrust their tongue and sorry thrust their tongue and then push the teeth out. So if your son has a thumb sucking habit or a tongue thrusting habit, definitely I would recommend that you take him to either his pediatric dentist or an orthodontist, and particularly if you have a family history of crooked teeth, take him to the pediatric dentist or the orthodontist, and they should be able to give you some kind of a recommendation on preventive orthodontics.
Okay. All right. I need to have my wisdom teeth removed. Will my insurance cover this procedure fully or partially? How can I find this out?
Um, so whenever you are going to have the wisdom teeth removed, for the most part, the plans that we see, that most of the plans are going to cover the wisdom teeth removal. Whether it is going to be partially covered or fully covered, it is going to be depending on the plan that you have. The reason I say the plan that you have, that depends on the employer that you work for, what your employer chose. Just because one person has MetLife, the other person has MetLife, and somebody may cover 100% and somebody may only cover 50%, depending on the employer that you work for. So it is going to be covered. What extent it is going to be covered, we can only find out after the fact that you come here, whether the type of procedure that you're going to need, whether, there are multiple codes that we use. For wisdom teeth, we have about 3 or 4 different codes that we use. So depending on the what your needs are, once you come to our office, and we are going to find out, and we are going to tell you exactly what your coverage is, or any dentist should be able to tell you what type of coverage you have.
Okay. Now, this one is a tricky question. My gums aren't bleeding or swollen, but they look white. Should I get this checked out?
What do you think?
I would, because
Yeah,
gums are supposed to be pink.
there we go. Right? Yeah. So gums are supposed to be pink. You heard from Fatima, not me, right? Yeah. Okay. Yeah. Cool. I was just kidding. Yeah. So your gums are supposed to be pink. So if you see any color changes, either white or red, or white or red, it doesn't matter. So you need to get them checked out. What the scholar may be referring to is there is a condition called ANUG, we say it, acute necrotic ulcerative gingivitis, so ANUG. So in that condition, we see that the gums have a tendency to get ulcerated, meaning like almost like an ulcer or like a skin that you see, your boo-boo that you're going to see. Here it may look red, but when it happens inside the mouth, because your mouth is always wet, it is going to turn white. So that means you have an ulcer in the mouth that possibly could have been caused by this condition, what we call it as ANAG, or any other condition. I'm just giving you an example. Then now your gums became white. So, and you need to get them checked out no matter what. Like you said,
Yeah.
anything
Pink
other
eye.
than pink,
Other than pink, look,
you get it checked
get it
out.
checked out.
Right. Okay.
All right. It says, Doc, I'm 20 years old and I think I have a problem with tooth erosion. My teeth have become discolored and I feel severe sensitivity. Even just touching my teeth causes a tingling sensation. A week ago, I had surgery on my wisdom teeth, and during that time, I didn't feel any sensation, but now the sensitivity has returned. Is there any cure for this problem? I'm really fed up with it. They're tired of that pain.
So what this person is referring to is anytime you have erosion on the teeth, meaning the teeth kind of like eroded away. Either it could be at the top of this on the top of the tooth, or on the side of the tooth, or it could be on the neck of the tooth. Um, when the tooth kind of erodes away, then it is going to cause sensitivity. Um, I I understand that you had a dental procedure done and that may have aggravated the sensation, the sensitivity. It may have aggravated the sensitivity, but no matter what, even if you did not have the dental procedure, or something or the other is going to happen, and it is going to aggravate the sensitivity. It could be as simple as, like, you may have a certain point, you had some erosion and nothing happened, and you did not have any sensitivity, but after you reach a certain threshold, now you're going to start to have the sensitivity. Maybe it's just the timing of that is you reach the threshold, and you possibly that threshold happened during the tooth extraction, and that's why you are having sensitivity. No matter what, you need to get that checked out when you have sensitivity, particularly if it happens around the neck of the tooth, which most of the time that we see. Either if you have a cavity, that you need to have the cavity filled. Sometime as gum surgeons, we see that the erosion happened because your gums are um, or people have sensitivity, not the erosion. People have sensitivity because the gums are pulling away from the teeth. So if that happens, talk to your dentist whether you need to get referred to like a periodontal surgeon like me. Then we can do the gum grafting for them.
Yeah, come see Dr. V.
Thank you. Thank you, man.
He'll get you right.
Yeah.
All right. I'm a 53-year-old female and I have been experiencing a burning sensation around my lips and tongue for the past few months. Could this be related to oral health or might be due to hormonal changes?
Well, sounds like you probably have done your research, and if you didn't have, nothing changed, right? And then if you're thinking that it is possibly like an hormonal changes, which we normally see in around the age of the menopause, or particularly when the women are getting older, it's not uncommon for you to have some kind of a burning sensation or some kind of an altered sensation in the tongue or like anywhere in the mouth. So it could be as simple as, either like you said, if it is due to the hormonal changes, when you are going to go see the doctor and then get your hormonal supplements, and the burning sensation might go away. Or it could be just a coincidence that you may need, some kind of a vitamin treatment. Then you may need to get some supplements, and your doctor may check you out because of this hormonal changes. Now your vitamin levels might have gone down, and sometimes, more commonly we see that vitamin B12 deficiency cause these kind of a nerve altered sensation or like tingling sensation or these kind of a altered sensation because of the nerve or some kind of a nerve issue. So it could be as simple as taking some vitamin supplements may help. So to answer your question, go see the doctor. Sounds like you already figured out it could be due to hormonal changes. If it is the case, go see the doctor, get it checked out either for hormonal deficiency or some kind of a vitamin deficiency, and the doctor should be able to treat you.
Okay. All right. Next question is, are there any signs of gum disease that I should watch for even if my teeth are cavity free?
Absolutely. You should be watching always, you should be watching for gum disease, even if you are totally cavity free. And as you may have listened to some of our answers earlier, or the things we talked about, you need to go back to the dentist, or if you're in the Dallas Fort Worth area, you need to come see us as well every 3 to 6 months. So particularly if you have gum disease, you need to come see the dentist or come see us every 3 months. So, what are the signs that you're going to be watching for? Bleeding gums, swollen gums, puffy gums, red or purplish, anything other than pink, right?
Anything other than
Then
pink?
pink, right? So red or purplish gums, and then tender or painful gums. When guess what? When you have pain, you're not going to stay away from the dentist. You are going to come see us, right? So tender or painful gums, and we talked about it earlier. Gums pulling away from the teeth, and we call it as a receding gums. Bad breath, loose or separating teeth, and the teeth are starting to get loose, and you have some changes in the bite. Your teeth don't come together. You're not able to bite properly, and you're starting to see some kind of a separation or a pus pocket on the gum. So if you see any of those, and those could be signs of gum disease, come see us. We can help you, or go see the dentist.
Yeah. All right, Dr. B, we have another live question.
Okay, great.
This one says, I feel self conscious about showing my teeth to the dentist. I'm concerned they might form opinions about me based on their condition. Is there some truth to this, or are my worries unfounded, doctor?
Man, so we always say that, right? And I think I had this conversation at the dinner table with my wife last night, and we were talking about something, and I had my teenage kids, with me also, my daughter and my son, and we had this conversation. Never lie to an attorney, like your lawyer or the attorney. Never lie to your doctor, right? So treat them like your friend. Tell them the truth, right? Unless you tell them the truth, they can't really help you. So don't keep that in your mind, that thinking that they are going to think bad of you, or they are going to think low of you. They are there to help you. Anytime I see my patient, my goal is to always help them. I never think low of them. And even if they think low, even if they think low of them themselves, my goal is to see whether how we can uplift them, or we can upbring their emotions. So it is not about like me doing the treatment. We always say that as practitioners, hey, we got to work together. So you I can be the best doctor in the world. If you think that treatment is not going to work for you, it's not going to work for you. So my assistants always hear me say that, like after I finish my procedure, I always say a lot of good gum healing thoughts and a lot of bone healing thoughts, right? Because we can always work on your mouth, but mother nature is going to always help you. So a lot of gum healing thoughts and bone healing thoughts, which is what we recommend. So going back to what you asked, do not think low of yourself, and do not think that your dentist is going to low of yourself. Tell them the truth, and they can definitely help you.
Yep. All right. The next question is, what are inlay and onlay restorations? Are they better than a crown?
So what they are referring to is, sometime when you have a small cavity on the tooth, it could be as simple as, just making a filling. When you have a large part of the tooth broken, not the complete tooth is broken, we refer to them as an inlay or an onlay. Although it is not uncommon nowadays, like for people, at least I do not see that more commonly in practice. Most of the time, either you're going to get a filling, or you're going to get a larger filling, or you're going to get a crown. So in the past, the filling materials, and particularly these tooth colored filling materials, or we call it as a bonding materials that we use for filling these teeth nowadays, they never used to be as strong as the metal. So we used to do the inlays and onlays in the past. But nowadays, with the advent of technology, we have these tooth colored materials or the bonding materials. They are as strong as the metal, or we are, although they may not be as strong as the metal, we are able to successfully repair the tooth with these, what we call it as a composites or the tooth colored materials, as very successfully. So to answer your question, your dentist is the best judge whether you're going to need an onlay, or you're going to successfully restore the tooth with the composite instead of an onlay, whether you need an inlay, or whether the dentist is able to successfully restore it just with the composite, or if you are going to need a crown, then your dentist is going to tell you. So talk to your dentist and they should be able to help you.
All right. This one says, "Hi, Dr. V. I read an article stating that orthodontic treatment may shrink children's mouths. It mentioned that teeth extractions followed by orthodontic retraction can reduce dental arches by up to 3.2 centimeters, which might decrease space for the tongue and potentially cause obstructive sleep apnea. What are your thoughts on this?"
Man, what a wonderful, wonderful questions. And even many of the dentists, like sometime they don't know this, and then sounds like, you probably you've done your research, and kudos to you, high five to you. Wonderful question. So what this reader is referring to is, I'm going to explain this question so that way you guys understand this. So whenever people have crowding of the teeth, and I'm going to show this, so particularly when you have a lot of crowding, and we are going to recommend, or the orthodontist is going to recommend, removing some of the teeth to correct the crowding. What this person is asking is, because now we are going to shrink these teeth, and it is going to shrink the entire mouth, and it is not going to allow for the tongue to lay, because now you're shrinking and you're pushing the teeth back. So when you're pushing the teeth back, then your tongue is going to fall back, and that is going to obstruct your airway, and that's just going to cause sleep apnea. That's what they are referring to is. So if you are truly concerned, there is a lot of research being done on this, and whether this is a true cause of sleep apnea, and there is a lot of research being done. So if you're really concerned, or whoever is watching this, and if you guys are concerned about this, removing some of the teeth because you need to get braces is going to cause sleep apnea, then, and you need to have the braces treatment done early enough. It could be as simple as you need to start taking your teeth to, you need to start taking your kids to the dentist as early as maybe about when they are 3 to 4 years, to get what we call it as a preventive orthodontics done, or when the kids are like in their early, like when they are in their elementary school or middle school, you need to take them to the orthodontist to get what we call it as an interceptive orthodontics. What they are going to do is they are going to expand the palate. So this is a palate right here. So they are going to expand the palate and to allow room for the teeth to grow. When the orthodontist is going to expand the arch, or like the palate, or the lower jaw, this is the upper jaw here, and then this is the lower jaw here. when they are going to expand them, now you are going to have more room for the teeth to grow. Now you don't have to worry about possible sleep apnea. Whether that is the only cause for sleep apnea, I cannot tell you that. There are so many other things that we have to consider. But if you are that concerned, then my recommendation is to have you take your kids to the orthodontist or the pediatric dentist as early as you can.
Okay. I think we have time for one more question. All right. It says regarding your video about how a tooth infection can impact the entire body, are there any simple ways to identify a tooth infection?
Man, multiple things, right? So these are things that you guys already know. When you have a toothache or like a pain on a tooth, you got infection, and that's what, like, most of the time it happens. And sometimes as simple as a cavity, right? It's a small cavity can lead into infection. So you have sensitivity to hot or cold temperature. That is a cause. That is a sign of infection also. When you have swelling on the face or swelling of the cheek or swelling of the gums, and that is a sign of infection. And as Fatima said earlier, other than pink,
Other than
right?
pink
Other than pink,
gums.
right? Other than pink, when you have redness or when you have whiteness of the gum tissue, so that is a sign of the infection also. When you have swelling of the gums, and as I said earlier, that is a sign of an infection also. It could be as simple as a bad breath. The bad breath is a sign of infection because bad breath is caused by gum disease, and that is a sign of infection also. And fever. Fever, particularly when it comes to fever, if you have unknown fever or undiagnosed fever, that could be a cause of infection. Then you guys already know that viral infection causes fever. Same thing. If you have infection in the mouth, that is a sign of infection also. How about like some pus pocket, or you have some drainage from the mouth or from inside from the gums anywhere? So that can that is a sign of infection also. A lot of times when patients come here think that, oh, I have something that I could feel. There is a lump that I feel here. That is a sign of infection also. And if you have difficulty in swallowing or cold temperature, drinking something really hurts and all of those things. So if you see any of those that what I mentioned here, those are all sign of infection. And as we say here, go see your dentist.
Go
Go
see your
Nike.
dentist.
All
Go
right.
Nike.
All right. Thank you, everyone. And
Thank you.
it'll
All
be another great show. And we look forward to seeing you guys next time.
right.
Thank you very much.
Bye.
Bye, y'all.